Hello and welcome to a very special episode of the O-Pod. Obviously, life has changed dramatically since we last spoke. The last podcast we recorded was on March 11th, where Senator Mike Rush and I discussed West Roxbury politics and local restaurants that we loved. It was 6 weeks ago, though it feels like it was 6 years ago. And as we all try to adjust to this, to use a trite phrase that's been well overused, new normal, I thought it important to bring the show back to have an informed and serious discussion with a public health expert. I was delighted several weeks ago when I got a text message from Patrick Costello, an old friend of mine with whom we shared a carpool 35 years ago. My team and I had begun doing check-in calls to seniors in the districts. We connected with Pat's parents, Jim and Kathy, and it prompted Pat to call me to thank me for checking in on his parents, who were doing great, of course, by the way, but also offered to put me in touch with one of his colleagues. Patrick is now the External Affairs Director at the Council on Foreign Relations in Washington, D.C., and he asked if I'd be interested in talking with one of their incredible experts. I, of course, jumped at the chance as an opportunity to both get a little more information and be able to share that with my constituents. So that brings us to today's episode, which will be both broadcast as a web-based video on some platform, as well as our typical podcast release. So I want to thank Patrick Costello, as well as Kate Gressamier, for helping us connect. Thank you, of course, to Jessica Morris, my producer, for helping us distribute this. I'm delighted to welcome Tom Bollyky to the O-Pod. Thomas J. Bollyky is the Director of the Global Health Program and Senior Fellow for Global Health, Economics, and Development at the Council on Foreign Relations. He is also a Professor of Law at Georgetown University. Go Hoyas. Bollyky is the author of the book Plagues and the Paradox of Progress and the founder and managing editor of Think Global Health, an online magazine that examines the way health shapes economics, societies, and everyday lives around the world. I could keep reading his incredibly impressive CV, but I think that Zoom would run out of bandwidth. Suffice it to say, Professor Bollyky is someone who's done remarkable practical and scholarly work in the field of health, trade, and epidemiology. I'm really thrilled to have him on the O-Pod. You may have seen him on MSNBC or CNN, or read some of his work in The Lancet or The Washington Post or The New York Times. I think it's safe to say, Tom, that you finally arrived by joining this podcast. Welcome to the O-Pod. How are you doing down in Washington, D.C.?
I'm great. Thanks for having me. It's my great pleasure to be here.
No, that's wonderful. So I was listing a bunch of questions that I wanted to ask you, and I truly don't even know where to begin other than gesticulating my hands wildly, which doesn't really work on a podcast. But how did we get to this point?
So we got to this point quickly. It wasn't that long ago that we were talking about a cluster of pneumonia cases of unknown origin in Wuhan, China. We found out about that on December 31st. We really, up until about mid-February, most of this outbreak was still localized in China. We saw our first case here in the United States on the 21st of January. It seems now there's some new evidence emerging that cases probably came even a little bit earlier than that. Mm-hmm. We have just found the first person who to die, the first person known to have died of COVID-19 on February 7th in the United States. She did not travel to China. So that seems to suggest that cases were here really since mid-January. The U.S. has become the epicenter of this pandemic, I'm sad to say. We have 600,000 more cases than any other nation, and nearly twice the number of deaths at 46,000 currently. We really don't just have one epidemic here in the United States, we have several. The Northeast Corridor, and particularly in New York, being one, but also with outbreaks happening or epidemics happening in the Los Angeles area, in Louisiana in particular, Florida. We have a number to get a hold of. So we have our work cut out for us, I'm afraid.
Yeah, we crossed 2,000 deaths in Massachusetts yesterday. And we're 196 deaths in Boston alone. So it's I now know people who have died from COVID-19, which I couldn't say a week ago, which is a very sombering experience. you wrote a piece in Foreign Affairs where you paraphrased Dostoevsky's quotation about prison, saying you can tell a lot about society by its response to epidemics of infectious disease. So, what can you tell about our society and the way that we've reacted over the last month to both preparation and safety measures and how they've been adhered to?
Yeah, so plagues put a mirror to the societies they afflict. What they reveal are the scope of our health programs, and to the extent they leave vulnerable populations out.
Yeah,
And what they've revealed in this case, unfortunately, is despite being the world's largest economy, with an embarrassment of scientific and public health expertise, we sleepwalked into the world's largest uh, disaster with this pandemic, and I think that is reflective of a moment where we had really decided quite early on that this was a problem from abroad
yeah,
and could be solved by the types of restrictions that we thought might keep it abroad. And unfortunately, that's had disastrous consequences.
mm,
So I think it, for the United States, in short, what it has revealed is that we continue to view the world's problems as being the problems of other people, and are that the solutions will be able to keeping those other people out, and that has clearly not succeeded in this case.
yeah, yeah. Despite the boasting otherwise of some individuals down in Washington D.C. But it's been very interesting to sort of look at how different countries have reacted, and you've also in some of your media appearances, I think, drawn the very astute point that you've got France and Germany, two countries that are similar population, similar wealth, literally neighbors to one another. I believe they had roughly the same number of positive cases, yet the mortality rate in Germany was a mere fraction of what happened in France. And so much has been written about Angela Merkel, who's a scientist, by training anyway. And I think someone who has been, I've always admired her. My admiration for her has only grown by leaps and bounds. And I wish we had more of that type of scientific approach leading this country. But can you talk a little bit about the difference between France and Germany? And the question I'm getting to is a concern that I'm seeing in the United States is that we have some states that are taking this with the level of seriousness that it deserves. And I would add and list the Commonwealth of Massachusetts as one of them. And then you have other states and other elected leaders who are flouting the rules and talking about, I mean, there are some states that are opening up nail salons and bowling alleys this week. So what lessons can we extrapolate from sort of the Germany versus France approach, and what is your concern that the widely divergent approaches here in the United States will create this just create more of this new life that we've found ourselves
Yeah. So being someone who works in a institution that focuses on foreign affairs is a in some ways a nice perch to be viewing what's happening. At this point, this pandemic is going to affect every country in the world. In a very real way, we're all on the same epidemic curve together. Some of us are ahead, like where we are currently. Some of us are behind, countries in Latin America and Africa. And we really have a lot to learn from each other's experiences. I will say it's been a good moment for women leaders in general. In addition to Germany, New Zealand has done quite well in moving and addressing this pandemic. And most of the countries that have done well in similar ways, with honest, science based risk communication from leadership about the challenges that wait ahead and what needs to be done to address them. They've done it with investments in testing, considerable investments in testing in Germany's case. And they've done it with great speed. And by doing that, they're able to identify people who are sick early, isolate them, um, trace their contacts, and quarantine those that might be infected. And it works.
Yeah.
And Germany has very early on adopted a very aggressive program on testing and has managed to keep their hospitalizations low. And that's really what matters here. There are two numbers that people should be tracking moving forward when states are deciding whether to reopen. The first is, what is the transmission rate? Is this epidemic still expanding? The second is, what is the hospitalization rate? For the number of people that are getting infected, how many end up in the hospital? Because what we're seeing is that 20% of the people that end up in the hospital don't walk out. 88% of the people that end up on ventilators don't make it. If this virus cases increase exponentially, if they do so, they can overwhelm your health system very, very quickly. So the only way to succeed with this virus is to do everything possible to get ahead of it. And that is fundamentally the difference you see between Germany and France. That, to some degree, is a difference we're starting to see in US states.
Yeah.
And just like internationally, how this doesn't break down between autocracies and democracies, there are lots of democracies that have done well, like Taiwan and Germany and New Zealand, and some autocracies like Singapore. In the US, it doesn't break down on a red and blue issue. Washington State was seen as one of the epicenters of this pandemic and really moved quite quickly to address it and to adopt social distancing policies early. New York was slower, and it really does seem, primarily in part through public transportation and young people. A significant number of those that have tested positive are people between 20 and 50 years old in New York, and that tended to be the spread. It was a bit slow. What is worrisome moving forward is we do start to see some states starting to want to lift restrictions early. And the challenge you have in that context is we just don't have we don't know enough about the testing to know if that infection rate is going down. We don't have any ability to track people who are getting infected to make sure they haven't spread it to others. And until we know that, we don't really actually know whether or not this pandemic, these different centers of spread in the U.S. are actually slowing down or not. And I'm worried about the states like Georgia opening the nail salons and tattoo parlors. Yeah. Hard to do a tattoo without spreading a respiratory virus. Or Nevada with casinos and the range of businesses that are being talked about in Las Vegas in particular. I shouldn't say Nevada, but Las Vegas.
No, the mayor of Las Vegas, I'm sure we've all seen it now, that her interviews with Anderson Cooper, Goodman is her name. It's beyond moronic. It's borders on criminal, in my opinion, just her approach to things. And again, I think people understand, at least in Boston and in Massachusetts, by and large, people understand the severity. But my concern is that, my question is, how do we, what's it look like when we get back to normal or some semblance of normalcy? I don't even know when that will be, because I feel like so many people are ready to just flaunt the guidelines and will just continue this pandemic. And we're already, I have questions about, a second wave, about whether or not someone can get reinfected, but I just don't know that. My biggest fear right now is that this will just continue for months and months and months. So, I mean, looking at what countries have done well, and you mentioned New Zealand, Germany, obviously, I think Iceland, obviously a smaller population, tested a huge percentage of their population. you've got countries that have imposed lockdowns at certain times. Some are reemerging somewhat, but unless there's a uniform standard, wouldn't different countries going in and out of different lockdowns have a huge impact on both the spread of COVID-19 as well as the economy, the world economy?
Yeah, so we're gonna be with this virus is gonna be with us for some time. I want to be honest with your listeners. Until really until we have a vaccine, which is probably a year and a half out at the earliest.
Yeah.
We're going to have to live in an environment where we need to be vigilant. That means uh, public transportation is going to be an issue, particularly unless we really substantially ramp up disinfection, and even then, it's going to be hard. As a native New Yorker, a subway car is a crowd. Everyone's together. Uh, about the tea, it's going to be a concern. People are going to be wearing masks for some time. We're going to have resurgences. There's no way to cut ourselves off from the world. And as you mentioned, in a country as big as the U.S., where public health policy is really a matter of states, we're going to have a lot of diversity between states on how we handle this, and we're going to get cases from other states happening. So that really means you need to be aggressively testing, and we need to have an aggressive ability to track those people who they've come in contact with. This is what that means in terms of timing. Right now, the estimates are we need to be testing nationally 3 million people per week. Right now, we're testing 150,000 people per week. The challenge with that is that's going to take some real investment to ramp that up. Most people's optimistic estimate on how quickly that can occur nationally is 8 weeks. If we move fast, and we have not moved fast on very much in this pandemic, if we move fast in 8 weeks, we're 6 weeks into this lockdown. Wuhan was under lockdown from January 23rd to April 8th, 12 weeks. 6 plus 8, of course, is 14 weeks. And it's going to be a struggle as a country to keep together for that long of a time.
Yeah.
So what that means, I think, is trying to really focus our investments in ramping up testing to areas where it is needed most, and we're going to have to prioritize. But for the time being, states really need to stick together because, of course, while this virus doesn't know any national borders, it certainly doesn't know state borders either. And we are really putting not only our own constituents at risk, but those of other areas as well.
Yeah, yeah. And I've been incredibly proud, as always, of the people of Boston. We've, put a curfew in. Just yesterday, it was announced that school closures will continue through the end of the school year across the Commonwealth. We've been pretty aggressive as far as states go. Again, it's too early to see the positive results of the data. I think most epidemiologists and public health experts here would say that we are in sort of the peak area. We've seen, as I mentioned, there've been in Boston alone 6,010 cases. We're recording this on April 23rd. There have been 6,010 cases as of yesterday. 1142 have recovered, so about 20%. And the death rate is 196, which is about 3%, which is lower than both the state average and the country average. I assume that's because we do have great hospitals and health centers here in Boston and access. We are seeing obviously some inconsistencies in deliverables of our access to healthcare and how that's sort of manifesting itself. But clearly this is something that is affecting us. We're taking it seriously. I worry that sometimes we'll have to take it more seriously to atone for the states that are putting no restrictions or lax restrictions in. And that very well may have to be our cross to bear. You mentioned the vaccine. I think that seems to be the biggest question. People seem to back up what you're saying, a year and a half. Can you talk briefly about the other sort of, I guess, silver lining? We've seen some data out about convalescent plasma, basically the blood of someone who has beaten COVID-19, so to speak, or recovered from it, being used in patients with severe cases. And can you talk a little bit about that, how that may be at least a hopeful sign for treating this?
Yeah. So, I mean, there are 100 therapeutic and vaccine candidates in development globally. This is pulling together a research effort like, frankly, the world has never seen. I'm a believer in human innovation. I really am. And so people ask me if I'm hopeful for effective therapeutics and vaccine, and absolutely I am. Doesn't mean it's going to be easy and it won't take time, but I really think we will see it. I think we will particularly see it on the therapeutic side sooner than later. So I don't want to give false hope, but I think there are some promising results, whether it's on the plasma products you mentioned, or on remdesivir, had some decent early results. We still have a ways to go there, but I think we will have a therapeutic, and that's going to matter. Where that matters is by reducing that second number I told you to follow, which is hospitalization rate. And if we can keep some people out of hospitals that otherwise might need to go, or at least make it a very short trip for them, that's going to matter a lot in terms of helping us reduce the risk of this kind of exponential surge that overwhelms health systems, like what you've seen in Italy, and frankly, like what we're seeing in New York.
Yeah.
So that's going to really matter. Where it will not solve our problem is on having to be vigilant, and we are going to have to be vigilant for some time. And unfortunately, this is again where plagues put a mirror to the societies they afflict. And the challenge we've had in marshaling a consistent federal response to what we're seeing, the challenges we've had in pulling together state leaders to stay together on this issue, unfortunately, is going to be exposed by this virus.
Do you, as someone who works and studies and has had such a great career sort of internationally at the Federal Trade Commission and others, do you have hope that you will see some real international collaboration on both funding and finding a cure or developing a vaccine? Are countries that normally would want to own the proprietary rights to something like this actually working together and sharing data to sort of speed up research?
So this is where I'm spending the bulk of my time right now working, is on that issue.
Right.
I do think there's a prospect for leadership in this space. We have to move.
Yeah.
It is a lot easier to negotiate that issues before the winners and losers in this race to develop a vaccine become clear. Once it is clear what countries have managed to succeed and where the manufacturing capacity will be, and it's going to be a lot harder to sort out those issues. I think it is possible because there is going to be a matter of necessity. This virus is obviously spreads exponentially, spreads easily, and can overwhelm economies and health systems. As long as it persists anywhere, it's a threat everywhere. So there is a commonality of interest. It is not, I should say in an understatement, a auspicious moment for global governance right now in terms of how countries have been getting along. So it really will have to overcome some challenges. And right now I'm sad to say, in terms of whether it's the group of 20 or the group of 7, the G7, the G20, unfortunately it's been the US that has prevented agreement in the recent meetings. So the last G20 meeting, the U.S. was unable to agree to a statement put out by all, or agreed to by all the other 19 countries over our refusal to fund the World Health Organization, the recent meeting of the G7. Also, the agreement collapsed over the US insistence that we call this the Wuhan virus, which other countries found unnecessarily combative. We're going to have to get over that and find a way to work with other nations. It's not just the US, there are other countries that clearly have not been helpful. China, particularly in the early days of this pandemic, did not do anyone favors.
Yeah.
But we're going to have to get past that and find a way to work together in the near and medium term.
Yeah. No, I could not agree with you more. For us to do, what people fail to grasp is that unless we're serious, unless we work together as a country, as a world community, as an international community, this will be our life. We a famed Boston institution should have taken place this past Monday, the Boston Marathon. For the first time in history, it was delayed until September 15th. I happen to have been training for it. I think it's probably at this point very unlikely that it will occur in September with a new date. I think Berlin just canceled their marathon, which is in October. This isn't going to end when the weather gets nicer. This isn't going to end when it gets summer and we're out of flu season. This is something that if we're not serious, if we don't readjust our behavior and it will just continue, and more people will get infected, more and more people will die. So I just so appreciate the work that you're doing, the research you're doing, your insight, the fact that you've taken a half hour to speak with us today. I guess, and with our closing minutes, because you've been so generous with your time, is there any message you would want to give to the people of Boston, or any thought that other things we should be doing other than the social distancing and the mask wearing and the curfew, and sort of, I guess, two-part, when do you see, I get what is the United States or the world going to look like 2 months from now? So the end of June, and then what additional steps do you think we should be doing in a major city like Boston that has the access to great healthcare institutions, but also has seen a significant number of individuals who've contracted this and who've been infected with this?
Great. So I will say, in general, there's no going back to normal. We only go through this epidemic, and we go through it together to find the other side of this. It's a process that will be more than a matter of months. It's going to be a matter of years to get all the way past this. That doesn't mean we won't get some form of relief. I congratulate what's happening in your city in terms of the sacrifices people are making to reduce the transmission of this virus and to protect not just the elderly, which you started by talking about, but also people with other conditions that make them more vulnerable to this. Yeah. This is something people aren't just doing for themselves; they're doing for their neighbors and families, and I think that deserves recognition. We've bought ourselves another opportunity, and what we need to see as a society or cities is that we take advantage of that. We take advantage of the sacrifices that everyone is making by investing in shoring up their protection for health workers, by investing in the monitoring we can do, by investing in the policies that can protect people in residential homes. This, as you've mentioned, isn't going to go away with the weather. It's circulating in the southern hemisphere as well. There's no reason to believe nicer weather is going to make this go away for us. But we can take advantage of the opportunity we've had so that the next time this reappears, it doesn't reappear with the same severity. In terms of what the U.S. looks like, I'm a little less hopeful. I think we're going to see a diversity of approaches by states, and we will see some states pay the consequences for that. And then the question is, again, what do we learn from that, and are we able to pull together? It has not been so far a great performance on the federal level in response to this pandemic, but I wish um, in the coming months that we do take the lessons on board and make some progress there too. This really is a moment for solidarity, both internationally and domestically.
Well said. Professor Tom Bolky of the Council on Foreign Relations, thank you, sir. Thank you for your extraordinary work, and to your colleagues. What you're doing is so impressive and so important in this time, and I know that we are just grateful you took some time to spend with us, offer some incredible insight, and just be safe down there.
Great. You as well. Thanks for the opportunity to speak.
Thank you so much. This is Matt O'Malley signing off for the OPOD. Please don't forget to subscribe to us on iTunes or whatever platform you use to listen. Everyone who is listening, we have resources on our campaign website, votemattomalley.com, particularly if you know of any senior citizens in District 6 or even beyond that need help, access to food or medicine. We can usually put them in touch with the right individuals. Also, we have a great interactive map for some of our local restaurants and businesses that are open. It is so important to shop locally in these times if you are able. And we have some tremendous resource for young people. As I mentioned, school will be closed for the remainder of the school year. The school building should be closed. School is still in session online and virtually, and we have some fun activities, including a coloring contest for our young artists in the BPS and beyond. And then finally, there's some resources available to put individuals who are out of work as a result of COVID-19 to be able to get the state support and the federal support that they need. Our hearts are with you all. As always, if you need anything, do not hesitate to reach out to me or my incredible team. We are here to serve you, and just know that we wish you all safety and health and love during these incredibly difficult times. This is Matt O'Malley signing off.